I'd like to respond to Galway's comment about Crohn's. They've just been diagnosed. Our GP, Dr. Merton, we're certainly seeing a lot more number of cases around Crohn's. And Crohn's, when you first get diagnosed with a long-term condition, can be very overwhelming in terms of what does it mean, how can it impact on your health, and what are the options available. So what is Crohn's? Crohn's is an inflammation of part of the digestive tract, and certainly in terms of your diagnosis, you would have had symptoms. So you may have had diarrhea, blood in your stool, weight loss, and extreme fatigue as well. And the way we diagnose it is with a stool test, checking for calprotectin, and that will be a marker in terms of how inflamed the bowel is. A blood test will also help, as well as a camera down the mouth and a camera on the back passage to see which parts of the digestive tract are affected. An ultrasound scan may also help in terms of certain images you might see when with Crohn's disease. So in terms of treatment, can be vary depending on whether you've got mild, moderate or severe forms of Crohn's, and that will depend on the disease activity, and also whether it's a flare-up or whether it's been ongoing for a period of time. When you first get diagnosed, you may be offered a liquid diet whereby you give your bowels a rest to try and reduce the inflammation, and that may involve just having high dose of Modulin, which will give you the energy requirement you need and also give your bowels a rest. Other forms of treatment might include immunosuppressants, so drugs which reduce the immune system to prevent it from getting inflamed, and they can include things like azathioprine and methotrexate. Their course of steroids may also be used to reduce inflammation, but that again will depend on case by case. There are newer drugs called biologics which have been used as infusions, and that has been very advanced and very helpful for a number of individuals, and so that could also be offered. Certainly if the medical treatment is not helping and there's parts of the bowel which are particularly affected, then surgery may be an option as well. So a few options which are available, and certainly at this early stage, getting as much information as possible will help in terms of how to manage it. There is a good website, Crohn's and Colitis, which I would certainly recommend in terms of getting your questions answered. But yes, I think getting your head around it and also make sure you ask many questions, getting them right, getting them written down. You should have a pediatric a Crohn's nurse who you can contact with and ask questions which you may have. I hope that helps. Thank you.